Excellent. All right. Thank you all for coming. And Dr. Williams, I'll let you take it away.
Okay. Yes. Good afternoon. Thank you for joining us today. This is meant to be a lunch and learn style. So for those of you who are watching, feel free to enjoy your lunch during this hour. I'm Rachel Williams from the Sunshine ERC's Occupational Medicine Residency Program. So on behalf of the Sunshine ERC, welcome to our guests from Rosen Hotels and Resorts and Rosen Medical Center. So the audience today, the people who are in the chat there are faculty and masters and doctoral level trainees from our ERC training program. So there may be physicians, nurses, industrial hygienists, safety professionals, industrial organizational psychologists. So we understand occupational safety and health to be an interdisciplinary effort. And so we study and we work in many different employee health functions and employee health clinical practice models. So today we're going to hear about the distinctive practice model there at Rosen Medical Center, which provides what I believe is whole person care to the employees of Rosen Hotels and Resorts. So we have three guests today, and so I'll let each introduce themselves with their title, their background, and roles and responsibilities. So we'll start with Kenneth Aldridge.
Hi, good afternoon, everybody. Hey, thanks first of all for allowing us to get to speak with everybody here from the different universities. I know there's USF, UCF, and even Emory-Riddle. So thank you again for having us. My name is Kenneth Aldridge. I do have a BSN. So I do have a clinical background, but I also have a master's degree in healthcare administration. And I've been blessed to be with Mr. Rosen and the team for 24 years. And so I've enjoyed the time that we've been here and all the creative things that we've done that we'll get to talk about today. Dr. Ryan?
Hi, good afternoon, everyone, if you're in Florida. My name is Ron Ryan. I'm a physician, board certified in family Medicaid medicine, as well as with a CPE from the American Academy of Physician Leadership. I'm the medical director here at Rosen Medical Center. And Rosen Medical Center is the provider arm of Rosen Hotels and Resorts. Here we take care of the associates, the employees, we call them associates here, of Rosen Hotels and Resorts, and they are our patients and their families are our patients. And I, together working with Kenneth as well as Jonathan, help to manage the health of this population. And I guess Jonathan.
And good afternoon, everyone. Thank you for having me and having us. I have the pleasure and privilege of serving the staff of Rosen Hotels and Resorts as their safety director. My responsibility and job is to keep our guests coming to a safe destination and our associates enjoy a safe workplace. And I am very blessed to have individuals like Dr. Ryan and Kenneth to help us keep our staff healthy and safe. I hold a degree in occupational safety and health and have been doing this here at Rosen going on about 18 years. And I enjoyed quite a bit, given the fact that Mr. Rosen is personally involved and invested into the safety and health of our associates. So it makes our job much easier when the senior leader has a vested interest in the safety and health of our staff.
Oh, Dr. Williams, you're on mute.
Sorry about that. So we'll proceed in that same order. I'll start off by asking you, Kenneth, just please tell us about the Rosen Hotels and Resorts. And I'm curious how a hotel business got into the healthcare business and how Rosen Medical Center is different from other corporate health or employee health clinics.
Yeah, absolutely. Thank you. How are we different and how did we get there? So just bottom line, we're all in healthcare. Bottom line, Mr. Rosen was just fed up with the healthcare system and the billing system. So back around 1991, Mr. Rosen would do everything he could to keep his employees healthy. And he had the traditional fully insured, one of the Cignas, Aetnas, one of the Bucas that we call them, the Blues, Uniteds that were out there. And that year, he knew that his history, his claims were lower, that he's keeping these people healthy. So what did he expect? And what would we all expect? To be able to go to the insurance company, say, hey, my claims were lower, my experience was lower, my people are healthy, my premiums should go down, right? That's the logical thing. Well, we all know it doesn't work that way. And the insurance company said, Mr. Rosen, it doesn't work that way. You're placed into a risk pool, and your pool is going to see a 20% increase in premiums that year. He said it's not fair. They said that's the way the way that it is. He said, you're fired. Now what does he do? So at that time he said, well, obviously we have to go become self-insured. So we had a little facility at one of our hotels that was housed by finance, and finance was actually moving to a new building that we just constructed. And so Mr. Rosen at the time was trying to decide, do I turn that into a daycare or do I turn it into a little clinic model, employer clinic? And obviously he chose the clinic, and I'm grateful because I have a job here at the Rosen Medical Center, but it absolutely made sense because he wanted to improve the accessibility. He wanted to improve the service that was rendered to his associates and be able to have more control of the outcomes associated to his associates and their dependents. So there we go. 1991, Mr. Rosen hired a part-time MA, part-time physician, and a part-time admin. And today we've grown to 2 facilities. We actually have a small little clinic also at the Rosen College of Hospitality with UCF. And they have 3,500 students there. So we have a small staff out there providing services. We have the main medical center that Dr. Ryan is in right now, where we have MDs, DOs, nurse pracs, PAs, dietary services, radiology services, laboratory services, and physical therapy. And and a chiropractor and a podiatrist. So a little bit of everything we try to put under one umbrella, because one of the things, 5 of our tenets that we look at is going to be access, quality, service, cost, and innovation. And the more we can bring in-house into the Rosen Medical Center, the better for our population. 30 to 35% of our population are coming from third world countries where they may have never had health care. And so it's not uncommon that we get a brand new associate and maybe they have, uncontrolled diabetes or uncontrolled high blood pressure with blood pressures in the 200s or 250s and A1Cs in the 14s to 16s. That's not uncommon, but it gives us an opportunity to do what we do best. And we're not that traditional medical center where, hey, we're going to wait for Jonathan to call us because he's not feeling well, or he's going to call us because he needs a physical. No, we're going to nag. Well, I don't want to use the word nag. Well, he said, Mr. Rosen's called me the CNO, Chief Nudge Officer. So we're good at nudging along to make sure that people are getting the things that they need. The mammograms, colonoscopies, pneumovaxes, whatever is needed to keep that person at or get them to optimal health. Now, when we reach out to our associates and those members, we're reaching out to them to bring them in. And Dr. Ryan and his medical team, we're drawing a whole panel of blood work. We're looking at where are we starting, but also what vaccines have you not had, such as the Shingrix or the Pneumovax or any of those type of things that can help with prevention, or Gardasil. And guess what? We have it all at the Rosen Medical Center, and it's available for free for our associates. So when you're looking at the history, he was just tired of the traditional insurance industry. And then what we've evolved to is to help us control and get and give our associates the best opportunity to achieve health. Now, removing barriers. So in healthcare, we have barriers all over the place. Deductibles, okay? 35% of Americans are delaying care because of deductibles. We have coinsurance service. After the coinsurance or deductible, you're going to pay a 20% coinsurance. Well, Americans are delaying care because they can't afford it. At the Rosen Medical Center and under Rosen, we call it Rosen Care, we don't have deductibles. We don't have coinsurances. Majority of our drugs, including specialty drugs that you see on TV that might cost $300,000-$400,000, we will cover if it's appropriate. We'd also cover bariatric surgery if it's appropriate, and Dr. Ryan and the team agree. We even cover, I don't know, okay, medical marijuana. I mean, there might be some on this call who are like, well, why medical marijuana? It could be a placebo effect. Who cares if the patient says, I feel better, my depression is gone, I'm having less pain with fibromyalgia, and I feel like myself again. And reduction in narcotics if they might have been on opioids. But that's what makes us different. We're not going to be that traditional health plan that's out there with the blinders at, hey, how can we save money now? Why? You heard Dr. Ryan's been with us, was it 9 years, 10, 12?
This is my 10th year.
10th year. Jonathan, 18. We have staff here who are almost going on, who are 30 years. So we're going to do what it takes now. Number one, because it's the right thing to do. But number two, they're going to be staying with us. We got 4 generations in one family that's still with us today. So if we spend the money now, we're going to continue to reap the benefit. And if we have healthy, happy employees and associates, don't you think that they're going to provide even better care to our guests at Rosen Hotels and Resorts? Absolutely. And if they're healthier, more active, are we going to have a reduction in workers' comp claims? Absolutely. So I'll stop there. I know that we only have 20 minutes or so. As Dr. Ryan would say, keep it short, Kenneth.
No, that was excellent to describe how different this model is. So yeah, I'll pose the next question to you, Dr. Ryan. So you mentioned you are a family practice family medicine trained. And you previously, I assume, worked outside this model. I think you had your own practice at one time. So I'll just pose this to you. So the 2022 Medscape Physician Burnout Report, dated just April 9th, came out. It shows that family medicine doctors rank 4th in burnout. 51% of family medicine physicians reporting burnout. For the occupational medicine residents listening, I want them to know that the preventive medicine is at the bottom of the list at 26%, just for comparison. So anyway, just keeping that in mind with the reasons that physicians report burnout, a lot of it is administrative burden. So I wonder what your experience has been there working at Rosen Medical Center regarding your work-life balance, burnout, and just what it's like to work there as a physician.
Thank you, Dr. Williams. So yeah, my background, I've had my own practice in the past, including renting out space for other practitioners from the business model. I've worked in hospice for quite a while. I've worked urgent care, emergency rooms, and in a lot of different types of settings. Coming to Rosen was quite a surprise for me and a very different experience. I've had no other experience like this one. It's such a very unique model. I can say that one of the most important differences is just the economic model and the incentives itself. When you're in private practice or even working for a hospital, it's really is revenue based. The patient comes in and you see the patient fee for service or capitated or whatever it is, you're getting paid really to see the patient. In the Rosen model, what we're really getting paid for is to keep the patients healthy. The question is, what's the return on investment of keeping the patient healthy? Well, our CFO would say, I don't know if I have my number might be outdated now. It used to be $300 million over the last 10 years. And that is because okay, I think
it's actually 500 million now.
Yeah, over the last 10 years. And why is that? Why does that happen? That happens because half of the healthcare spend is on hospitalization. So keeping patients out of the hospital, keeping them healthy, really is our goal. So by saving the parent corporation lots of costs, lots of money, we are able to do things that I don't know anyone else out there can do. So coming to Rosen Medical Center, you know, you look at all these MGMA statistics and ratios of how many support per physician and what kind of pounds you're supposed to have. And all of that was completely wrecked in this company. I mean, the average amount of patients a person has as a family practitioner is between 2,000 and 3,000. Over here at Rosen, we brought it down to something like 1,000. And that would be unheard of. You can't make a living outside doing that. Well, the point is that if you have less patients and can spend time with more patients, it's almost like a concierge practice. But at the same time, you're saving that much more money for the parent corporation, and thus your return on investment really is there. That allows us to do some things that people practice in other situations can't. As far as the providers here, I'm very intent on keeping the lifestyle and the work-life balance to be something that is manageable and that works. I read one statistic that said that if family practitioners or primary care physicians did everything we're really supposed to do, as far as prevention and talking about you know, the psychiatric problems and the PHQ-9s, the twos. If we did everything for every single patient, we'd have to practice 23 hours a day. It really is very difficult, which is why the major complaint out there from patients' point of view is that, you know what, the doctor doesn't spend any time with me. Well, there's a reason for that. Number one, they have to see so many people at one time. And the second is that there's just too many things to do. We allow our physicians here to have 30-minute appointment slots. Again, pretty unheard of. You can do work-ins if you want to, but we're able to handle it, those time slots, and able to put in the time we need with patients. The providers here, we've made it so that there's not really a call. I take call, and another physician does. I'm the medical director, but you know, with the help of Kenneth and third parties, we've been able to make a system, even with a concept called Crucialist, that's sort of an extension of our business that handles after hours calls, not even through, let's say, nursing, but through actually ER physicians. So we try to, Mr. Rosen keeps us on our toes. He's constantly sending us articles about what the newest thing in medicine is, which is really interesting. Or, you know, we have an insurance arm as well, whether it's whatever department you're in, he's going to be sending you articles on it. And so we try to be innovative here. And so to your question, though, yes, the lifestyle, life-work balance for us, I think, is a good balance. I think that our physicians are happy here. And we have a pretty low turnover at this point.
Good. Yeah, thank you. Low turnover, that speaks a lot about the job satisfaction there. So next I'll ask Jonathan about how does the Rosen program compare to others in the hospitality industry in terms of worker safety, injury prevention? You mentioned workers' comp claims. Do you compare yourself against other similar industries in the group?
Thank you for the question. Yes, we do. We actually, as Dr. Ryan alluded to, we have this insurance arm. Mr. Rosen also owns a commercial insurance agency through which property, casualty, and health benefits services are sold, but also loss control services. And that entity is able to go to other hotel groups or other industries and say, hey, here's Rosen's losses when it comes to workers' comp, when it comes to general liability and guest and customer safety and food safety and public health and all these other areas. Here's our numbers, and here's how we can help you. So the model has worked so well over the years that we're able to stand out. You know, getting into some numbers in insurance jargon, there's a rating that you're given. If that rating is over 1, then your losses are above what they should be. And your premiums are multiplied times that. If it's 1.5, then you're paying 1.5 times the premium you should be paying. If it's less than 1, then you're below average. A hotel group this mix, Rosen Hotels and Resorts, this amount of hotels and client mix and restaurants and spas and golf courses, you tend to see a mod somewhere in the 1.2, 1.3. And right now, we're having a bad year, and we're in the 0.8 mod, and we've seen it as low as 0.6. So we're in a position to be able to go and say, just don't take our word, just look at our numbers. But all that goes back to what I mentioned initially, which was we've got a leader that is involved. We've got a leader that is interested and is invested into what actually happens. Mr. Rosen, to this day, still reads every single incident that occurs in our company. All associate incidents, all guest incidents, anything that occurs, he will review and he will ask personally about these things every single month. When you have somebody like that, that drives progress, that drives the operation to go beyond the box. I think the Rosen Medical Center and the Rosen Care Program is a perfect example. So it drives us to see what we can do that may not be normal for the industry. So, for example, hotels normally don't employ safety professionals. These are individuals that have some sort of safety degree. These are folks that have gone to school, but most importantly have done this in the field, have managed, confined space work and heavy electrical work and fall protection and stuff like that. Hotels tend not to have those professionals, but we do. We do because we find that it is the only way to be able to manage safety to the extent that our leader would want us to. If we're going to have an unwavering commitment to the wellness, health, and safety of our associates, then that's what we must do. So I think we're in a position that we're different. I think that we're different, and most of that is good. There's some weirdness and quirkiness to being different, but it's worked out very well for us. So I would say that in sort of in a summary, that's sort of what makes us different.
Yes, thank you. So just to follow up on Kenneth, you mentioned that you provide care during work time, and I saw on your website you even provide transportation between the different sites to get to Rosen Medical Center. So it's obvious to me that you want people to use it. You mentioned nudging people and sending out reminders. So I'm curious, what percentage of employees sign up for this? I understand it's part of the benefits, but what percentage of employees sign up, and then what percentage use it?
Yeah, no, that's a really good, really great question. So we do have, if you sign up for the Rosen Care, Rosen Medical Plan, that this is your primary care. This is the place that you would have to go unless you live in other states, because we have kids going to college. We have some members that live in like the Tampa area, all the way out to Cocoa. So those individuals are removed from the mandate that they have to come here. We're into the 94%, somewhere around the 94% come to this facility. But we also do things to, again, nudge people. Hey, did you get your mammogram? Did you get your colonoscopy? Or have you come in for a physical exam? And those kind of nudgings, and now, with the telemedicine that we've got, we have opportunities that people don't have to come to the Rosen Medical Center or, come to the facility for the care. They can have it, through a televisit on their phone. So we work very diligently that we know exactly who's admitted in the hospital every single day. And we're cross-referencing that. We're looking at, hey, this individual's in the hospital. When was the last time they were here at the Rosen Medical? We recently had a patient who just picked up the insurance in the beginning of January, and unfortunately, they were admitted into the hospital. I think it was in either February or March. I mean, we're going to do everything we can to get the individuals into our medical center, but things happen. But of course, right after that person's discharged from the hospital, they're immediately into Dr. Ryan's and the team's hands to be able to coordinate that care, get them to the specialist or whatever needs to be done. But the goal is to, number one, keep patients out of the hospital that don't need to be there. Number two is if they're in the hospital, get them out as quickly and safely as possible, either into hospice or into a skilled nursing facility or into a long-term an LTAC. Get them out, or into home health care. Get them out of the hospital where I think the number is now 200,000 people die a year because of medical errors or what have you. So that is one of the premises that we do remove those barriers to the access of care, because we know that ultimately, if somebody has a heart attack, number one, shame that, well, hey, could we have done something better? But number two, what if they die? Now we've lost an associate and we've lost a family member. So we do everything we can to provide that service and get the patients, drive them here. And Dr. Ryan and I are working on some other opportunities to, again, make it easier, because we have a large percent of our population that take 2, 3, 4 buses just to get to work. So think about that. Think about the SDOH, social determinants of health, that impacts 60% of one's healthcare. Not the medical, which is like 10, 15%, but I'm talking about social determinants of health. And Dr. Ryan and our team are working on some of those things to try and provide resources for our associates.
Yeah, thank you. Yeah, in the College of Public Health here, that's always at the top of our minds. We've seen a lot of that affecting our employees currently related to COVID. And you mentioned that you also take care of the dependents of your employees. Even you said 4 generations, work for Rosen. So I wonder, Dr. Ryan, that like for my practice, most employee health clinics, they manage that employee population, but they're healthy working adults. So you have, all ages. I wonder, how do you communicate with and meet the needs for that diverse population?
Yeah, thank you for that question. It's a very good question. First, as a clarification, we see here at Rosen Medical Center from the age of 15 years and up, those family members who have their own pediatricians when they're younger than that. But yes, we see a great age range at Rosen Medical Center, and we do see generations. To a certain extent, when I first got out of residency, I was in a place called Claremont, and it was a small town. Basically, it was kind of rural, and this kind of acts like a small town, for good and for bad. So people talk, and we have diversity, and we have a lot of different types of patients. So some concrete things that we do is, first of all, because there's so many aspects to that question. The first is that we have lots of different cultures here. In the hospitality industry, there are just lots of people from different countries who work in hospitality. So for example, 30% of our workers are Creole Haitian. Many of them don't speak English. We have a large Latin population as well. And so, part of what we do is to have and hire people who can translate and speak the language and also address the culture. One of the things in this model that we are able to communicate on a general basis, while maintaining HIPAA, is that, some of the cultural preferences really do influence workers' health and their outcome. One example is, a few years ago, we realized, because some of the people that we hire were from Haiti, that some patients didn't want to get, or weren't showing up for their blood draws. We realized that they thought that, if you were getting your blood drawn, that you would be somehow taking their spirit or something out of them by doing that. And so it was just a cultural bias that needed to be addressed. And so in communicating this, we were able to go out to sometimes the hotels and just begin to get education on general health talks, which, can go a really long way. So, so that's just the cultural aspects. We also have a very divergent socioeconomic. I mean, Mr. Rosen comes to Rosen Medical Center. So everyone from the top to the housekeeper are coming at the same time. And so our providers do have to be very sensitive to that and to who they're seeing. We know that as we see people, we are in the hospitality industry. And so one of the things that I always talk to the providers as they come in is that, remember the people we're seeing are people who are used to giving hospitality. So we as medical providers have to have a very different mindset. Even though in hospitality industry, they would say, they talk about the customer, and we don't have customers, we have patients. At the same time, though, those patients are very sensitive to how they are treated and the manner in which they are treated. And I think if we use that rule of treating everyone as if they're a hotel guest, even if you have to give them bad news, then it gives a very different way of treating anyone that comes through the door. And that covers a multitude of sins. So treating a divergent population becomes a bit easier when you're treating everyone like that.
Yes, Kenneth, you had to say that.
Yeah. So just really quickly, I want everybody to know there is a barrier, a wall. I mean, HIPAA is absolutely abided by here. So if we've had the situation, if we have a security officer that that person's 2 kids had to have bone marrow transplants and cost us $1 million, we're not going to be telling Mr. Rosen that it was a security guard and this is the name of the. Now, if the security guard goes and tells Mr. Rosen, that's a totally different thing. So just make sure you understand there's a HIPAA barrier wall between Rosen Medical Center and Rosen Hotels and Resorts. That's important.
No, that is definitely important. And that is a pitfall when employers start to deliver healthcare to their own employees. What is an employee-based concern versus what is a patient concern? So I'm glad you brought that up. Yeah, to have it all in place.
Matter of fact, we have 2 databases, like even the information, even though you may be a patient at Rosen Medical Center, if you have a workers' comp injury, is not even put in the same database. It's completely separate. And we prefer for that person to see people who are different than who they usually see. So yes, we're very cognizant about that.
Great. So regarding patient-centered care, that's what we call it here at the VA. When we're looking at the person, the whole person, in terms of where they are in their life, where they are in their culture, what are they bringing, and what matters to them as a patient. That's what we call it here, patient-centered care. So I wonder, from an employee safety point of view, Jonathan, what input then do the employees have in suggesting safety initiatives? Are there any initiatives that your employees have suggested and that are maybe the most innovative part of your program?
Well, at the end of the day, they are the subject matter expert. No one knows their job as well as they do. It is an error. It is a mistake for anyone from the outside to come in, spend a couple of hours, and think they understand all of the demands and all that entails that particular task or that position. So if the subject matter expert is not part of your assessing team, then you really have very big holes in your process. So it's important to engage and have the associate feel that they are a leading part of any assessment, of any development, of any initiative. And that achieves a number of things. One, it informs your process. It makes it effective, but it also brings about the buy-in from the staff because they were part of the development. So to carve that out and to come in and say, well, we are the experts, no, you may have some general theory knowledge, but as to the application to that job role, that position, they are the expert. So it is very important to engage them in. If there's any change on procedure, if there's any change in equipment, if there's any change in process, it's key to be sure that they are involved, because at the end of the day, they're going to give you the nuance, they're going to give you all that detail that you just be blind to because you don't know what you do not know. So our staff attends all of our safety discussions and meetings. They are part of action committees, and they're called different things at different hotels, safety warden, safety star, or ambassador, whatever that may be. But the idea is to engage them. So yes, as a short answer, if you don't engage them and have them as a leading role in your process, you've got too many gaps in your initiatives.
So Kenneth, do you have an example of that?
Well, first I wanted to say I do enjoy going to those safety events with Jonathan at the hotels, because it gives us different perspective on operations that we're not part of. The other part I wanted to talk about, Jonathan's talking about we have our associates participate because they're doing the job. Let's take a step back in healthcare. What happened in Tennessee just recently with one of the hospitals in Tennessee, where a nurse did the right thing, gave the wrong med, reported it, and she was thrown under the bus. So what is that going to do in healthcare? Not one person is going to want to, well, I mean, if they're going to do the right thing, they're not going to want to admit that they made a mistake. We have just pulled ourselves back in the safety realm of healthcare, and that I'm hoping that gets appealed, and that people, nurses get together, it's physicians, everybody, to realize, hey, we've got to be able to report incidents and to be held accountable appropriately, but not to get thrown under the bus criminally while others are taking a blind eye to it. Not appropriate.
So I could give an example, a simple example. When I came aboard, I couldn't understand why some of our room attendants would refuse to keep their back straight when lifting the corner of beds, right? So we have 2 beds per room, 4 corners per bed, somewhere in the neighborhood of 14 to 16 rooms per day. So and beds in hotels get thicker by the year, right? More comfier, and the way that you dress the bed is not with elastic ends, is with straight sheets. So you have to tuck them in, and so it's a lot of lifting, awkward lifting in some areas. And I couldn't comprehend why they continue to bend at the waist, and we continue to see back issues, until I said, you know what? I got to go talk to an expert. So I went and spent a day with a subject matter expert, a room attendant. I cleaned rooms all day. I almost died, but I cleaned rooms all day. So I realized that it hurted more to bend at the knees than to bend at the back. So, Jonathan, if I put a knee to the floor to lift the corner of the bed, I won't be able to get up. So I'd rather hurt at the back than hurt at the knees. And I realized, I said, you've got to leave theory to the side, and you got to come and understand the operation. How can I ask you to lift with your back straight when one of the corners is behind a nightstand and you have to stretch your arms? So this is not about, here's what the book says about safe lifting. No, let's go and understand our environment and our staff. And only then can you be successful. So I think that's a good example of how the subject matter expert instructs us as to what our programs need to be.
Yes, in healthcare, we call that a systems approach, not blaming the individual, but looking at the system that allowed that error to happen and intervening in those specific places. We look a lot at those, patient harm, even near misses, we want to know about so that we can prevent any harm. So I just wanted to mention, and Kelly mentioned in the chat, that if there's any audience members who have a question for the panel, please enter them in the chat, raise your hand. And I'll also ask Dr. Burns, who is in attendance, if she has any questions for our panel.
Thank you. Yeah, I was wondering about your interdisciplinary practice in that. Maybe Dr. Ryan could speak to the sort of how the other disciplines Ken mentioned all the different disciplines there that you have under one roof at the clinic. Can you talk a little bit about the interdisciplinary nature of care?
Oh, yes, I certainly can. I think this is one of the nicest parts of what we do here, especially when coming to the workers' comp piece. So, for example, I had a housekeeper who came in last week and came in with low back pain. She had been actually to one of our standalone emergency rooms and came back. She was still in pain. And so, you know, she was on medicine already. We were doing some things. And so I walked down the hall and I talked to Dr. Williams, who's our chiropractor. He said, bring her on down. So brought her on down there. And so we were able, after his treatment, and he does, to be fair, Dr. Williams is a person who does, a chiropractor who does micro manipulation. It's very different. It's a subspecialty that doesn't do like full range snapping of the neck and that sort of thing. So it's micro manipulations, very small changes through an instrument. So there's no harm that really that you could do. And so with that treatment, you know, she was able to get up and walk and be a lot more comfortable. The following week, patients are as patients are, and so she forgot or didn't make a subsequent appointment or didn't know she had to, and so she got a little bit behind, but we were able to get her back with him and get her also into our physical therapist, which was a door down. And so Kim and Dr. Williams worked together with this patient without a lot of medications and was able to, you know, get her functional without a lot of opioids and a lot of other types of pain medications. So yes, the interdisciplinary portion of what we do is really important. Of course, we have our specialists and our orthopedists and all that we refer to, and we are very choosy about you know, who we pick, and we like people that we can talk to, where we can pick up the phone and say, hello, you know, what's happening with this patient. It's a little bit harder on the workers' comp side, just because on the workers' comp side, it's a different carrier and a different group, and that's a little bit, you know, harder to negotiate. But certainly on the medical side, yeah, you know, there's a lot of crosstalk in order to get the patient to where they need to be, and some of it happens actually on the fly, just like I described.
Are there other interdisciplinary groups or programs like an accident review board or whatever you would call it, a group that reviews any of the workplace injuries to look for system changes that could be made?
We have a group that meets monthly in the sense of going over certain workers' comp claims. And making sure they're going through the system. We also have a workers' comp coordinator at our company who works directly with myself and with our human resources. She's sort of a go-between, who calls these patients, why are they not showing up to their appointments, or, you know, oh, you know, the provider said that we really need that, whatever the imaging was, in 3 days, it hasn't happened. Why hasn't it happened? You know, tracking down, et cetera, that sort of thing. So we have a group that does that on that end. I don't know on the safety end if there's any other type of group that meets to look over the actual mechanics of the injury. I'll leave that to Jonathan.
Yes, so our goal is to have any incident documented, not just those things that rise up to the level of an OSHA recordable or a compensable claim, but any injury, and as our associate handbook reads, regardless of nature or severity, must be reported immediately. And the idea here is, not to only tackle those things that are claim size, because once you have a claim problem, you have a problem. So you want to be able to prevent things from becoming claim issues. So the idea is any incident that is reported, and sometimes we'll have an associate that bangs their hand against the corner of a desk and comes down, and there's no injury that we can tell, there's no pain, but that's the mindset that we want to see. Any incident come, and every morning the risk management office, my office, will review every incident that arrives, and we communicate with our HR team and with each of our locations, our hotels and our departments, to investigate the root cause of that incident. And as you said, it's easy to fault the associate or the employee, right? Let's say, well, they tripped and fell because they were rushing, right? And some people just say rushing, the root cause. No, that's not a root cause. That's an immediate cause. What is the systemic failure? And many times it's a managerial failure that led to that. So are they rushing because we're understaffed? Are we understaffed because there's budget considerations that we're not taking into account, right? So most often you will find the root cause to be a managerial failure. So the idea is to try to investigate those things to their appropriate root cause, so that then we can really prevent them. Otherwise, we're just hitting immediate causes, and that's just band-aids that is not really going to have an impact.
Thank you. So I have a question in the chat box from Dr. Giovinco, who's asking about the culinary medicine program. So as part of your program, is there nutrition support, dietitians, or a culinary medicine program? Tell us about that, please.
Are you okay? So I'm not sure if you're aware or not, but well, I'm sure you are. Rosen Hotels and Resorts has the Rosen hospitality school, of course, yeah. And so we have had some pilot program with the culinary section of that in conjunction with the School of Medicine, working together to come up with, and we did that one year kind of as a pilot program. We haven't done it since that just started right before the pandemic, and we have not picked it up since then. Culinary, oh, you're talking about as far as nutrition. Yes, so we do have also a diet. We've traditionally had a dietitian on staff. We lost our dietitian with the pandemic. We have hired another one now, and that person works with our college. We've also had a third party called InHealth, which is a third party coaching dietitian. These are all board certified dietitians. That's been working very well for us. And in a sense, it actually works a bit better. What we found was that when we had our dietitian, when we referred people often to that person, it was almost impossible for that one person to be able to handle our population. We've had to hire an army. But with this third party entity now, they have multiple people that do these touch points once a week or 3 times a week, where they're calling individuals. You can, refer as many people as you want to the program, and it seems to be working quite well. They just gave us a report and had some statistics about significant weight loss, and we're expanding now into other diagnoses. So that's what we're doing with that.
Yes. Okay. Thank you. Yeah, I've figured, in a resort, you have access to a lot of wellness services. Are any of those wellness services open to your own employees? I know that's kind of a interesting line to cross there, but do you permit your employees to access any of the spa or other wellness services?
Not the spa, but we do have a wellness center. And in our wellness centers, we have exercise equipment. There's a whole program as far as the fostering health and wellness within Rosen hotels and resorts. So, and of course, we always have to talk pre-pandemic and post-pandemic. Pre-pandemic, we had all sorts of programs. We had cycling, spinning in the morning, for which myself and Kenneth were part of. Real killer. As well as those spinning classes, Tai Chi, let's see, Zumba. Can you name some others, Kenneth?
Yeah,
And then the
those
regular
are-
exercise equipment.
Yeah, those are the big ones, the Zumba, Tai Chi, kickboxing, boot camps. They had a little bit of everything from a wellness perspective.
Yeah.
Oh, and all free.
Yeah, and those all these folks have access to that, but not to like the spa.
I was just curious. And then there's a question in the box that asks about, we've mentioned a couple of times how your program is different and unique. And so the question is, how many large corporations have this kind of healthcare program, in their work practices and work areas? Do you know what the fraction is?
So, I mean, so the Rosen type of model, it's very far and few between. Now, there are a lot of employers now that one of the largest employers here in Orlando, he's got these big old ears. They copied the Rosen model. Did they do it themselves? No, they did not. They got a third party. And it's not to the level of what, Dr. Ryan and the team have over there. But more and more employers are looking at on-site, near-site, direct primary care models, PCMH models. We Rosen Care have a program that we've put out for one of the large school districts here in Florida, serving 9,200 people, employees and dependents, and have brought significant improvements, not only in service, but outcomes. Put in a lot of the same type of programs that we did at the Rosen Medical Center, we did at that health center also. So there are more and more employers that are out there that are looking to do something like this because they too are just fed up with the trends in healthcare and trying to control their own destiny.
Okay, so I have a couple questions asking about a cap. Is there a cap of expenditures for a single employee, or how do you handle any pre-existing conditions? Do you cover those in the same way that ACA requires?
We do. We have to. And I'll give you, here's a prime example that I tell every single time. It was Dr. Ryan's patient. I'm on a call and he comes into my office and puts a name and a date of birth and see me. And it was a brand spanking new patient to the Rosen Medical, to Rosen Hotels, and they were already worked up for a full cardiac transplant. So did we get to do anything from our preventative side? No. We could not do a pre-existing condition side, no. And that cost us about $185,000 that we could not do anything about. So from a pre-existing side, no, we even have pregnancies that come onto our plan. They're like 8 months pregnant. So we're scrambling, beg, borrowing, stealing to find an OBGYN that will take them. And we, Dr. Ryan and our entire team, we have a program to mitigate premature pregnancies. So we have a nurse that's responsible for not only our inpatient, but all of our pregnancies. We know how many we have. We know our high risk. 56% of our pregnancies are high risk. That's a big number. In Orlando, the premature rate is, I think it's around 10 or 11%, and we're running about 7.6%, even with the high risk population that we have. So bottom line is, I do miss the pre-existing days, but put my other hat on. I do like that our associates have access to healthcare immediately. So I hope that answered the question. One hat says yes, let's see the patient. The other hat's saying, oh my goodness, 185,000. We have to go to Mr. Rosen. When we're over budget. Working on budgeting again.
Right. I think it's obvious to me, and I'm sure to people listening, how much you invest in your employees. I wonder, how does that show do you have any statistics about, maybe employee turnover or absenteeism or anything that you point to say, see, our employees are indeed happier and healthier?
Yeah, absolutely. So we technically can say that our turnover rate is less than 15%. But you'll hear also Mr. Rosen, and I can quote him saying that we're in the single digits. And so that, leads to healthier, happier employers. They're staying with us. And I even ran into an associate who just came back from being laid off. And one of the biggest reasons he's back was not only because of Rosen Hotels, but because of the health benefits. So from a turnover rate, we are not measuring absenteeism and presenteeism. I would love for us to get there one day. And maybe with some of our new predictive modeling analytics and also AI that we'll get there one day. Because, here, prime example, myself. I went to my office a couple of times and I had a major headache, migraine going right through my left eye. And what would we typically do? Go home, go rest, here's some med. I went right next door to Dr. Williams and I was back at my desk in 6 minutes. No headache, gone. So that's reduce absenteeism and improved presenteeism because I was able to stay at work and be functional. I've had gastroenteritis before. What do? They stuck me with an IV and taken care of and then right back at work. I mean, our goal is to get our patients and our associates healthy and keep them at work because, 40% of Americans are living, one paycheck, $400 away from financial crisis. We're very sensitive to that also.
Thank you. We're at the end of the hour. I wonder if you wanted to give us any resources or ways that our attendees can look up these services. And also because we have trainees who want to learn, maybe opportunities for them to learn and opportunities for them to seek employment after they're done with their training, since it's such a great place to work.
Absolutely. Yeah, thank you. I mean, that's absolutely where I wanted us to go. We do have openings, and Dr. Ryan has some positions open in the clinical areas. You can go to rosencare.com and see the awards that Mr. Rosen has won, and Dr. Ryan and the team just won an award for what we did for the pandemic. And I wish we had time to talk about how different we were, how we were so far ahead of everybody else in relation to the pandemic because of the Jonathans of the world, the Dr. Ryans of the world, so that we can keep our associates healthy, safe, and get them back to work. But yeah, definitely look at rosencare.com. There's a bunch of podcast videos, a listing of all of our awards, a little bit of some pictures about the Rosen Medical Center and all the services that we offer. So please come check it out and take a look at our website for opportunities in the future. But from myself, I thank you, everybody here, and keep on fighting the fight as we continue to all improve healthcare. Dr. Ryan?
I think Kenneth was able to give the resource. I think that, what you all are doing, going into healthcare and specifically into worker safety is admirable. And, as, one mentor told me, we should keep the reason that we go into healthcare despite the systemic things that try to, kill the real altruistic reasons. You got to keep that so that when you get out there, you're dealing with patients that comes back and you know the reason why you're there. That's what I would say.
Jonathan?
Yes, I think that folks in the health field that have a genuine heart and interest for worker safety, it's always what at the end of the day serves both the employee and the employer. When those people with those hearts in healthcare meet an employer with the same heart, then the employees are best served. So not all companies out there are horrible. There's companies out there that do care greatly for their staff, and they need a partner in healthcare, and vice versa. So it is great to hear that people are interested in these topics, and in any way we can be of assistance, feel free to reach out. I'm not sure if our contact information will be shared, but I'll be more than happy to assist in whichever way I can.
Yeah, we would love to share that information. So yeah, our mission here at the Sunshine ERC is making a difference. And so that's what we're training our all of our trainees to do in each one of those fields. So thank you so much for sharing how you're making a difference there at Rosen.
Thank you very much.
Welcome.
Have a great day, everybody.
Thank you all.
Thank you for an excellent presentation.